let's talk about one of the most critical events in medicine, a child who's actively seizing.
You know the scene. A parent runs in, child in their arms, and suddenly, nothing else matters.
Because in this emergency, time isn't just time is brain.
This isn't about panic, it's about a precise time-based plan of action.
Once you hit that 5-minute mark, we have a name for it, status epilepticus, a true medical emergency.
2 clocks are now ticking. At 5 minutes, we must treat. At 30, the risk of permanent injuries skyrockets.
In those first few minutes, the brain actually has its own natural brakes to stop the seizure.
But the longer it goes, those brakes fail. The seizure gets locked into a self-sustaining loop.
And this is so important. The worst cases don't start in the ICU, they start with early hesitation.
So in those first 5 minutes, you're stabilizing the ABCs while you're preparing to intervene.
The path forward is crystal clear. You have a plan with IV access, and you have a plan without it.
Be decisive, give a full dose, repeat it once if you have to, and then you move on.
If the seizure's still going, it's time to escalate. You pick one of these second-line meds.
You know, the biggest delay isn't about pharmacology. It's about that human factor, hesitation.
These are the common failures we see. They aren't knowledge gaps, they're delays in taking action.
If that second-line drug doesn't work, the game changes. This is now refractory status epilepticus.
So, the seizure is stopped. Great, but the work is far from over. Now we have to ask, why? And now the real detective work begins. Was it an infection? A toxin? What was the trigger?
I love this distinction. Stopping the seizure saves a life today. Finding the cause saves their future. If you remember anything, remember this clock. 5 minutes, you treat. 10 minutes, you load. That's what saves brains.
So in the end, it's simple. Speed protects the brain, but it's precision that protects the future.